Welcome to the Savvy Dentist podcast with Dr. Jesse Green, the show where great dentistry meets great business. Listen in each week as we bring you an inspiring person who will share their story, ideas and business techniques to help you create a practice and a life you love. And now introducing your host, Dr. Jesse Green.
Hello everyone, it's Jesse Green here. Welcome back to SavvyDentist.com and to the Savvy Dentist podcast. It is great to have you for another episode of the show. Now today I'm going to be talking to you about a really important topic, and that is case acceptance. And specifically we're going to be diving into objections and how to handle them, because we all know that when we present treatment, it's not always readily accepted. And so we need to have some strategies about understanding objections and how to handle them. Now, before we get into the conversation about objections, I wanted to talk to you a little bit about a course that we've got coming up, which we are super excited about. In actual fact, the course is going to be called Advanced Treatment Coordination for Dental Practices. And the reason we've written this course is because we noticed that there were some people in the practice who are really good at case acceptance and some people who struggled. And we wanted to put in other resources into the practice so there was consistency across the board, because we know that when we've got consistency of case presentation and case acceptance across the practice, we see everyone winning. The patient wins because they're receiving the best and most optimal dental treatment that they can. And that means they're going to have long-term dental health. They're going to be happy they've made those decisions moving forward. Now, the practitioner also gets to win because they get to do the dentistry that is engaging and interesting to them. And of course, the practice wins too because they're getting a greater commercial outcome as well. So there's a win in there for everyone. Now, with this particular course, I'm going to be joined by Robin Wood. And many of you would know Robin Wood. She's the 2IC at the OrthoEd Institute with Dr. Jeff Hall. And Robin's been a treatment coordinator for well over 20 years. And frankly, what she doesn't know about treatment coordination isn't worth knowing. So on this one-day course, which is going to be online on Zoom, so you can do it from home or do it from the practice or wherever you want to be, we're going to be covering a bunch of things. And we're going to be talking about the case for having a treatment coordinator in your practice and how to introduce a treatment coordinator if you haven't already got one. But we're going to be talking about how to align the expectations, the systems, and the path forward of the practice owner and the treatment coordinator together. So you're working as a team. And then we're going to be looking at bottlenecks and how to identify them, and then, of course, how to remove them, and as well as other inefficiencies or any other issues as it relates to treatment coordination. So we want to figure out why patients might not be saying yes to treatment and remove any obstacles that stand in the way of that. And then, of course, there's a bunch of other things we'll cover. Particularly, we'll be talking about metrics, what to measure, why that's important, how to understand those metrics. We're going to be talking about, ultimately fine-tuning and systemizing the process so it runs like a well-oiled machine, and that across the practice, you're enjoying those higher rates of conversion with a whole lot less friction. And that's what we're going to be covering. So I really encourage you to come along to that. It's going to be an epic event. And as I said, it's a one-day event. It's going to be held on Zoom on the 26th of August. And to register, all you need to do is go to SavvyDentist.com/treatment-coordinator. That's SavvyDentist.com/treatment-coordinator. And come and join us. We're looking forward to that. We can't wait. It's going to be a huge event and a ton of really good stuff there. Now, the good thing is, it's one ticket price for the whole practice, so all you need to do is come along and register, and we'll see you there. But now let's start talking a little bit about objections, because they are a fundamental thing that happens all the time. And I think when it comes to objections, one of the things is that a lot of people need to understand is that they happen. And we just need to have the skills and a process for handling that objection, because we know that if we've got a skills and process for handling case acceptance generally, well, then part of that process has to involve objection handling. So I think what we need to understand for a moment is that objections aren't necessarily a no. They're often a question. Sometimes they can be a no, but they're not always. And if you think about the different personality profiles or behavioral styles, whether it's DISC or Myers-Briggs or anything of that nature, what we often find is that there's a group of people, particularly in the DISC profile, which are the high C type of people, the analytical types, that just need a lot of answers before they make a decision. And so what happens is that sometimes those questions or that need for further information really comes across as an objection. And they may not be. And sometimes they are. We just need to have a way of overcoming that, or at least handling that. So just before we get into that, I want to make sure that I say this very clearly. Handling objections doesn't mean we're trying to get people into some verbal Jedi mind trick where they suddenly accept treatment that they don't want or is not in their interests. I'm assuming up front that everything we offer to patients is in that patient's best interest, of course. But we're not going to get to 100% case acceptance. We're not going to magically make everyone fall into a trance and say, yes, Jesse, I'm going to have every treatment that you've ever offered or proposed. That's not what it is. What we're trying to do is to make sure we understand what that objection is for the patient and present the treatment in such a way so that they can get past that objection if they want to. Now, what we need to understand is that objections really come in 5 categories. We hear all different sorts of things come out of patients' mouth, but there's really 5 primary objections. And typically the first objection that we hear is money. And the words that come out of the patient's mouth is they either can't afford it or it's too expensive. And one of the things that I find in Western culture is that when someone says we can't afford it, it's almost like a social red line to cross if we want to start talking about money. In other cultures, they're much more open about talking about money, and I'll show you how to handle that in a moment. But the second most common objection that comes up is time, and what patients might say is they're too busy right now, it's the wrong time of year, maybe they're waiting for their health fund to kick in or whatever it is. And so, that's a time-related objection. The third category of objection is really around value, and they might be saying, like, I'll think about it, or I'll leave it for now, or do I really need this, or words to that effect. They're questioning their mind, do I really need this? Is this the best use of my resources right now? The fourth type of objection is really around comfort. And they might say, I'm worried it'll hurt, I'm not sure I can sit through that procedure, or something to that effect. Now, the fifth one is around trust. And oftentimes this objection will go unspoken. And if it goes unspoken, typically people will say yes, 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 and then ghost you. And that's really a trust-related objection. And the other thing that they may say, however, is, will this work, or will this work for me, or how confident are you that this is going to work? And so when I was a young dentist, the other thing they used to say as well is, how long have you been out of university? So these are trust-related objections. And so I think it's really important that we understand that those 5 categories of objections really are very important to understand, because what we want to understand is what's going on for the patient internally. What's their emotional state? What's the things going through their mind? What's the conversation they're having in their head that they may not be speaking about? And once we understand what's really going on, then we have the opportunity to address that objection and see if it's the real objection or if it's a bit of a smokescreen. And I'll talk about that in a moment. So typically what happens when we are presenting treatment, we're going to offer the treatment, and then we're going to go through a process of testing for acceptance. And that might be, how does that sound to you, or does that sound good, or whatever it is you might be saying. And at that point, if the patient is not ready to proceed, they'll come up with an objection. And our job is to firstly listen to that objection, and then of course acknowledge the patient's concern, and then use an objection handling technique to help understand the patient, that we can get past that. And so I wanted to talk to you briefly about 4 types of objection handling techniques. And so the first type of objection handling technique is what I would call the feel, felt, found method. It's an old one. This is one I learned way back when I was in network marketing. It was the very first objection handling technique that I ever learned. And it goes something like this in basic terms: is I understand how you feel. Other people have felt the same way, and what they found is blah, blah, blah. And it's an empathetic type of objection handling technique. It's basically saying, you're not alone. We see and hear this all the time. We deal with this, on a day-to-day basis, and this is what we've found works for most people, and by inference and by extension will work for them. And so you might say to a patient, Mrs. Jones, I understand you're anxious about experiencing pain. Other patients have felt that way too. However, what they found was that with today's modern anesthetic techniques, they were very comfortable throughout the procedure. And so that's a feel, felt, found. And it's the metaphoric arm around the shoulder saying, we get it, we understand you, and we've got a way of handling that. The second type of objection handling technique that is used is called the objection as the reason for proceeding. And typically someone might say, I don't have time, or I can't afford it. And you might say, well, let's say they said, I don't have time for the appointment. Look, that's exactly why you should have the crown now. By crowning the tooth, we're going to prevent it breaking and avoiding more time in the dental chair later on. So we're using their reason for not doing it as the very reason to do it. In other words, saying if we do it now, yes, it might take a bit more time, but you're going to save a whole lot of time at the other end, by preventing the breakage, down the track. So that objection handling technique number 2 is the objection as the reason for proceeding. So the third technique is what I call name the elephant. And for some people, they may not be familiar with the phrase or term name the elephant, but really naming the elephant is really giving voice to what's going on that no one's really talking about. So before I get into how to use it in a dental sense, you might have experienced this in your personal life or in a family situation where, just as an example, maybe you've got a couple of relatives that don't get on and don't really connect. And every time they're together, the atmosphere is such that you could cut it with a knife. And let's just say you've got a Christmas party coming up and Uncle Bob and Aunt Betty, who hate each other's guts, are both invited and they get there. And, the air is as thick as anything and you can cut the atmosphere with a knife. Really naming the elephant would be saying, come on, Uncle Bob and Aunt Betty, we've got to sort this out. There's an issue going on. It's addressing the thing that everyone knows is going on, but no one's really talking about. And so sometimes the name the elephant is around calling out what you see or what you think is going on. And you might say, Mrs. Jones, it appears you have some concerns about proceeding with treatment. What is it that's worrying you? And then they'll say, well, do I really need this or whatever it happens to be? So that's objection handling technique number 3, name the elephant. Now, objection handling technique number 4 is around solving the problem. And in essence, what we're saying, if we could find a way to solve that problem, would you be happy to proceed? So you might say, if it was a cost objection, if we could find a way to fit that treatment into the family budget, would you be happy to proceed? And they'll say yes or no. So what I really wanted to talk to you about was how I handle cost objections, because the cost objection is perhaps the most common objection. And so what I say when there's a cost objection coming up is I'll either use the objection as the reason for proceeding. That's exactly why you should have the crown, Mrs. Jones. By crowning the tooth, we're going to prevent it breaking and therefore avoiding costly treatment in the future. So that's one way of doing it. But the way I primarily do it is I use a combination of methods 3 and 4. So what I might say is, Mrs. Jones, she'll say she can't afford it. I'll say, look, Mrs. Jones, if there was a way that we could fit the treatment into the family budget, would you be happy to proceed? And if she says yes, then I know I've got a real cost objection. And so that's really useful to me, because then I'm going to negotiate payment terms, payment plans, and all the rest of it. I'm not going to negotiate price. I'm going to negotiate terms. Now, if she says, and hesitates, then I'm going to go to the name the elephant and say, look, Mrs. Jones, it appears you have some other concerns about proceeding with the treatment. What is it that's really worrying you? And then she'll say, look, I'm not sure I need it. Is this going to work, or whatever it happens to be? And the reason this is important, the reason I do it this way, is because particularly with cost, as I mentioned earlier, it's a bit of a social red line. And sometimes people will throw out, I can't afford it, because it shuts down the conversation. And I'm going to encourage you to lean into that conversation with grace and with goodwill, and just explore that a little bit further rather than retreating. So I just want to tell you a little story about that for a moment. I really don't like clothes shopping. In fact, I loathe it. I hate it. And if I'm in a clothes shop, I'm there to buy. I'm never there browsing. I don't like it. Get me out of there. When I go clothes shopping and I'm looking through the clothes racks, whatever it is, and the shop assistant says to me, can I help you? My first thing I say to them is, no thanks, I'm just looking. I've just indicated to you that I'm never just looking, but I say that because it basically puts a little bit of space between me and them and gives me a little bit of breathing space or thinking time or whatever it happens to be. And in the dental sense, the I can't afford it is almost the same. It's people just putting a bit of space between you. And sometimes maybe they can't afford it. Maybe it genuinely is a cost objection, and that's okay. And we've got ways of helping them with payment plans and the like. But oftentimes it's not the only objection, or it's not the real objection. And our goal is to get to the real objection and help people solve that so that they can get the treatment that we know that they need. So just once again, there are really 5 categories of objections which we spoke about. The first one was money. The second one was time. The third one was value, which is different to money. Then comfort, and finally trust. And as I said, trust will often go unspoken, but if it is spoken, it's things like, will it work or will it work for me? We spoke about having a process for handling objections, which was, testing for acceptance when we offer the treatment. If an objection comes up, great, we listen to it, we acknowledge the concern, and then we use one of the 4 objection handling techniques, which, just to recap, are the feel, felt, found method, the objection as the reason for proceeding, the name the elephant in the room method, and then finally the solve the problem method. So hopefully that's really helpful for you. Hopefully that's given you some understanding around objections, because objections really are questions. A lot of people need these objections handled before they can buy. So an objection is not necessarily no, it's just I need to overcome this hurdle before I proceed. And that's really important to know. If we recoil from objections rather than lean into them, we're going to miss the opportunity to have that treatment be accepted. And that's not good for the patient because they're getting less than ideal treatment. It's not good for you as the clinician because you don't get to use your repertoire of skills. And it's most definitely not good for the practice either because the practice has to remain commercially viable. So there's lots of good reasons why you want to master case acceptance and specifically how to handle objections. It's where people really trip up most commonly. So hopefully that's really helpful for you. Now, just to go back to the beginning of the conversation, as I said, having a treatment coordinator in your practice really is going to be key to helping you get your case acceptance up because they're skilled at objection handling, they're skilled at case presentation. It means you're not relying on that one underproductive or less than productive associate dentist or therapist or hygienist or whoever it is. It means you're going to have evenness and consistency across the board. So do come and join us for the Advanced Treatment Coordination in Dental Practice workshop, 26th of August, Zoom online. It's one fee for the whole practice, so that's great. So you can do it from home, and all you need to do is head across to savvydentist.com/treatment-coordinator, and we look forward to seeing you there. But for now, I hope you found that objection handling process helpful, and I look forward to hearing how it goes for you. Take good care. Bye for now.
Thank you for listening to the Savvy Dentist podcast. For more episodes, go to drjessiegreen.com/savvydentist. And to discover how to build a high-performance dental practice, visit drjessiegreen.com and download the free report.